physical therapist on the internet.
Hi folks, I'm Bob Shaw, physical therapist.
Brad Heineck, physical therapist.
Together we are the most famous physical therapists on the internet.
In our opinion, of
I
course.
always remember
Bob.
posture.
Posture.
Today we're going to talk about the 7 most important questions to ask your knee surgeon. So I'm assuming you've got some knee pain and you're going to have surgery to remove the pain, hopefully, and restore function. These are questions you may ask. Now, what I want you to do here is we're going to go through the questions, but then after this, you can actually print out these questions.
Right.
We'll tell you where to do that, and pick out which ones you think are important to you that need to be answered. Because there's no surgeon that'll answer all these questions.
Yeah, this is a really good idea because when you go to the doctor, you get overwhelmed, and then you walk out and you say, I forgot to ask him this and I forgot to ask him that. And there may be things on here you think, wow, that's a really good question. I wish I would have thought of this before.
And you don't realize what you need to plan for, what your house does. So let's get started off. The first one is, this is a physical therapist speaking. You got to try physical therapy first. You got to ask your doctor if that's okay. Because if there's minimal risk to having the surgery a little bit later, why not try a conservative approach to treating your knee? And you may not even need knee surgery if you do that.
And one way or another, you will have better chances of a faster and a more more efficient
recovery.
More successful recovery if you do therapy prior. And then sometimes they call that prehab. Very common.
Okay, number 2, what is the risk to not performing the surgery now? So let's say, what would happen if I waited 6 months or a year? And, will it compromise that I won't have as good as long-term outcome?
Sure.
These are the good questions because, again, if you're also worried about your health, like it might decline in the next year, you maybe don't want to go through surgery. So all those factors should be discussed with your surgeon. Number 3, what are the alternatives to knee surgery? Again, conservative approach. Besides physical therapy, there's anti-inflammatories, there's injections, sometimes just education. So, again, what are the other options? Surgery is not a minor thing. I mean, whenever you have surgery, there's chances of infection. I don't want to get all bleak here, but there's always a risk.
Yep, there is. Typically, they go quite well, and the vast majority do.
Right. The vast majority. Number 4, what is your expected length of recovery? How many days will you be in the hospital? These are really good questions. I got some sub-questions underneath this, Brad. How long will you have to follow the knee precautions? Now, knee precautions, usually it's like, how long do I need to weight bear with a cane or a walker? So
yeah, there isn't too many precautions compared to a hip replacement.
Exactly. It's not as much. Are you going to need full-time or part-time care? For a lot of people, yes. And so for how long? Or do you have to go to a nursing home?
And sometimes that works out better. We even did a video on the one woman. She was young, relatively young, about 60 years old. She had both knees replaced, went to the nursing home, and she said it was very helpful for her to go there. She actually went back, and she's a restaurant owner. And you remember her? She's going up and down stairs, and
she's on video.
Very active person, yes.
So I have a friend that's 60 years old, and he did it both ways. One time he went to the nursing home. He hated it. That was just him. It's a personality type. And the second time, he stayed at home, and he had some people come in to help him. So either one works, but you have to figure out what works for you. Will you need a hospital bed at home? That's a good question. How soon will you be able to walk after surgery? What are your weight bearing status going to be? How much weight can you put on? Will you need crutches or a walker? Often they'll give you one.
You're gonna need something.
Yeah, you're gonna need something. Can you lie on this side that was operated on?
Good question.
Yeah, and some of these you can ask your therapist afterwards. I mean,
exactly.
How soon will you be able to climb stairs? Another good one for the therapist. When can you shower after surgery? That's usually the doctor decides that.
Right. Yep.
Or the physician's assistant.
Right.
Yeah.
Someone, one of their
One of their
assistants.
teams.
Yep.
Yeah.
Nurse, assistant, whatever.
One that we hear a lot is, when can you drive? And again, we put that at a doctor. I'm not going to tell them that they can drive when. So
Yeah, because there's some liability issues there.
I definitely have seen. Probably shouldn't even say this, but I know that people that will have surgery like on their right leg, and they'll drive with their left leg. For
Yeah, they'll crisscross through. That's
can be
not
dangerous.
advisable.
Yeah. How soon will I be able to resume housekeeping, gardening, walking? These are, again, it might be more your therapist to answer that question.
Right. One of them that I always tell the patient, you're going to have to ask your surgeon, is can I kneel on it
right
in the future for either, house duties, or
yes.
I've had a carpenter where he, that was his life, can he kneel on it and when can he kneel on it? So we actually did that part of therapy, but there's some doctors that say it's not advisable.
Yeah, it's not advisable. You can kneel on the shin, but you can't kneel on the knee.
Yeah, or you have to have an appropriate knee cushion.
Because, what do they do quite often? Not quite often. I don't even know if they do this anymore, Brad. I'm not a surgeon. But they actually shave off part of the kneecap and replace that too.
Mm-hmm.
So they may shave it so thin that you could crack the kneecap just by kneeling on it.
And that's going to vary patient to patient.
The surgeon, again, has to determine that. When is sexual intercourse feasible after surgery? Important for a lot of people. Which sports can you participate in? Again, it might be your therapist that answers these. When can you return to sporting events? And we already went over that one, how to resume housework and gardening.
Sure.
So. And for a lot of you, it might be, can you write down I never can? I never can get back to housework. So,
retired from housework, my spouse is going to take care of that.
This, by the way, this number 5 is the most important question you're going to ask. Because you're going to ask your surgeon, how many procedures do you perform every year? How many knee replacements? And because they have found through studies, no surprise, that a surgeon who specializes in a specific type of surgery is way better at it. Right. So you want to have a surgeon that's done at least 50 to 100 knee replacements, if you're going to have a knee replacement.
Yep.
Or maybe arthroscopic surgery, they've done 50 to 100. You want, people that, surgeons, I remember we were talking to a surgeon one time, and he goes, I live, eat, and sleep this type of surgery.
Yeah.
He goes, that's all I think about. So, I mean, that's what you want.
Right.
You want a guy that's just totally devoted to that. What are the risks of complications, and what is your complication rate? You want to see, one of the surgeries I was thinking about is the one where they have to thread a catheter up and through to the heart.
Yeah.
Like I remember the complication rate. I don't remember what it was, but it was like 1% or 2%. And this doctor had like a 0.005%. It's important. There's guys that are really good at what they do, and there's some that are, they're
not as good. They're still getting there.
I've had some terrible surgeons that we knew in our life. They come, their patients come in, and you just knew right away it was from him because there'd be some deformity.
Yeah. Obviously you have someone in mind right now.
I do.
Yeah, I do too. But they don't practice anymore.
No,
the one I'm thinking of.
Same with me. He never practices anymore. Okay, if you're undergoing knee replacement surgery, you should ask. These are specific questions you may want to ask. What is the implant made of? Are you going to set off metal detectors at the airport?
Right. Yep.
How long will it last? What can you do to keep your joint replacement working as long as possible?
Right.
That may be your therapist. Again, activities can make it wear out more quickly, and you need antibiotics for dental care.
Right, that's a big one.
Yeah.
When you go see the dentist, if you've got a replacement, the hardware, for some reason
it attracts.
Yeah, it attracts infection. So you can have a dental procedure and then get a knee infection in your total knee afterwards.
Yep, happened to my mother-in-law. Not necessarily from knee, from hip, dental
dental
procedure.
But that is a very common one. So
Right.
yeah, and it's surprising because you wouldn't think of. I mean, we think about it because we know about it, but completely unaware of
Right.
it. People are.
So go to bobandbrad.com, go to the program section, look for this title, which is the 7 most important questions to ask your knee surgeon. And then there's a PDF along with the video.
You can print all this out, go through it, highlight or write down the questions that you want to make sure you get answered so you don't forget. It's going to be very helpful just to have that. And all we ask is a couple $100 for this PDF. No, I'm completely kidding. It's zero cost. We don't even ask for your email. It's just a gift.
We want this frictionless, that you can get through there and feel like it's going to be very easy. Look at some of the other videos. They may pertain to you.
Absolutely.
And, there's like, how many? Do you know? 40?
30, 40. You always
we don't know yet.
100, but it's there's plenty. Just look at the titles and make sure you got enough ink in your printer.
Yeah,
that's the only thing.
All right. Take care.